Hospitals throughout the valley are beginning to resume elective surgeries, which had been put on hold during the pandemic. And now doctors are telling patients not to delay their care. Today I spoke with a neurosurgeon at Desert Regional Medical Center, Dr. Randall McCafferty. Dr. McCafferty, thanks for joining us.
Thank you for having me, Peter.
So before, obviously, elective surgeries were not allowed during this pandemic, but things are beginning to change. Can you talk to us about that?
Sure. During the pandemic, we had, as other hospitals across the county, reduced our load to purely urgent and emergent surgeries. And what I can tell you today is that we are slowly reopening. We are gradually increasing using CDC guidelines, state guidelines, county guidelines, along with the local experts to continue to create procedures to make it safe for us to continue to deliver previously delayed and deferred care.
So is it safe now for people to come to the hospital for these elective surgeries?
It is absolutely safe. We have been dealing with infectious disease for ages. This is a new challenge. We have overcome that challenge. We have come through the crisis and surge period, and at this point in time, we are now starting to take care of all that care that's been delayed in the past. We've implemented procedures across the emergency room, across the OR, across our nursing units in order to ensure that patients will be delivered safe care just as they had before.
What are some of the types of surgeries and procedures that have been delayed that you're now going to start seeing again?
Well, all the surgeries are on a case-by-case basis. Surgeons are bringing their cases to the hospital, and essentially what we're trying to do is prioritize those that continuing to delay those patients might bring them harm in the near future. But any type of surgery that you can imagine, we will continue to do if we find it essential, whether it be hip replacements, spine surgeries, whether it be a colonoscopy, all these procedures can be done.
And how are things right now at the hospital? I know that they're still treating patients with coronavirus.
That's correct. So we are seeing declining numbers. We have sequestered the COVID positive patients and the patients under investigation across the hospital. We have opened up other areas of the hospital for increased elective care, as well as other care that we've been rendering during the pandemic, because we are a stroke center, we are a trauma center. We do deliver babies at this hospital. That has continued to go on through the pandemic. We're now just expanding that to patients that are outpatient as well.
Dr. McCafferty, is there a specific message you want the community to hear right now?
The message I want the community to hear is don't delay your care any longer. Go see your physician, have a conversation with them about what care that they need to have rendered. Desert Regional Medical Center has put in policies and procedures to ensure that you're safe. We can deliver care very effectively, and we don't want to see that patients continuing to delay care that they deserve to receive.
All right. Dr. McCafferty, thank you so much for joining us.
Thank you very much, Peter. I appreciate your time.